This is part 7 in our articulations lecture, and in this part we're going to begin looking at some various joints of the kind of middle and distal aspects of our upper extremity, so specifically joints that surround our elbow joint. So the first one is our actual elbow joint, the elbow joint proper, and this is referred to as the humeroulnar joint, right? So if you think of the humeroulnar joint, you think of the name humeroulnar and the bones that make this up, we're obviously going to be looking at the humerus, and we're also going to be looking at the ulna as well. So this is the elbow proper. This is the true elbow joint. So whenever you flex and extend your arm at the the forearm at what we think of as the elbow joint, this is occurring between the humerus and the ulna. And we have a couple of different features here, right? So the distal aspect of the ulna the distal aspect of the humerus, we have a region known as the trochlea, right? And the trochlea means pulley. And so this is the pulley around which our ulna will pivot and move, right? So the distal end of the humerus, we have the trochlea. At the proximal end of the ulna, we have a region known as the trochlear notch. And the trochlear notch is this large kind of concavity that we see here on the ulna that then slides in and hinges with the trochlea itself of the humerus, right? And so on either side of the trochlear notch, you have processes of the ulna. You have an olecranon process, more posterior, back here, that's the point of your elbow that you see. And then you have the coronoid process here that's more anterior. And these slide into and out of their respective fossae of the humerus, known as the olecranon fossa, as well as the coronoid fossa, right? So this is a diarthrotic joint, right? So our joint is moving with a range of motion that we can notice, we can tell. So free range of movement, so it's diarthrotic. It is synovial. It is uniaxial as a subtype of synovial. So we have one plane of movement, so we can flex the arm at the elbow and we can extend the arm at the elbow. Those are the only two movements that we can do. Excuse me. You can also supinate and pronate the arm, the forearm, but this is occurring at a different joint that we'll look at next, and that is not occurring at the humeroulnar joint, right? So it's synovial, it's uniaxial, and specifically it is hinge, right? So just like a door hinges open and closed, our elbow joint is going to hinge to produce flexion and then hinge back to produce extension, right? So if we now look at an associated joint next to this humeroulnar joint, this is the humeroradial joint. So instead of looking at the humerus and the ulna, now we'll look at the humerus and the radius. This is sometimes lumped in with the elbow joint, but it is a little different. It's not the elbow proper as the joint that we just mentioned. So this is a joint between the distal end of the humerus, so this little ball-like round structure called the capitulum, with the proximal end of the radius known as the head of the radius, or the radial head, right? So normally the head of the radius articulates with the capitulum that you see here. So here's the capitulum, here's the radial head. Usually these are in contact with each other. And the radial head is also in contact with a region of the ulna known as the radial notch. And so the radial notch is a part of the ulna, it's not part of the radius. And this joint between the humerus and the radius, so the humeroradial joint, as well as the radial ulnar, the proximal radial ulnar, this allows us to go from a supinated position of the forearm to a pronated position, right? So having our hand out with the palm up to then rotating that over and then having the palm down, going to pronation, right? So what helps to keep the radius and the ulna intact and somewhat helps keep the radius in contact with the humerus is a ligament known as the annular ligament. So if you look at the term annual or annular, it refers to annual. And so like if something happened annually, it happens once a year, once a cycle. And so think of a large circle that then comes around and meets itself where it started. The annular ligament does the same thing. So it's a cycle. It stretches around the head of the humerus and it binds the head of the humerus in place and keeps it in place with the proximal aspect of the ulna. So you can have something known as nursemaid's elbow, in which the arm is pulled superiorly and kind of anteriorly by the hand or the wrist, and it pulls the radial head somewhat away from the capitulum of the humerus, as well as away from its articulation with the ulna as well, right? So if you look at the position here, so here's a hand that is kind of raised up above the head. This is normal elbow, so you can see here the distal end of the humerus and the proximal end of the radius and ulna are in contact with each other. They're normally articulated. And then here you can see what happens in a nursemaid's elbow. So this is where this radial head moves away So it subluxes away from this capitulum, and it also moves slightly away from the ulna as well. All right, so it's not as in close contact with the ulna. And so think about what age of person, what age individual would have their hand up like this, and so what age person is this common in? Well, if you think about it for a second, this is somewhat common in young children, right? And so young children who are holding their parent or guardian or somebody's hand moving across a street or whatever it may be, their hand and their forearm may get pulled away from their body, and in doing so, you may pull the radial head away from the capitulum. You may also pull it away from the ulna as well, right? So this is known as nursemaid's elbow, okay? All right, we're going to stop here with this part. This was a relatively short part, and then we will pick up by talking about our hip joint, and then we'll finish by talking about our knee joint, so joints of the lower limb.